Hi, it's Gary Chimes from Lake Washington Sports and Spine, and we had a request to do a video talking about tennis elbow. So tennis elbow, there's other names for it, like lateral epicondylitis, although it really should be called lateral epicondylosis. Itis implies inflammation, which it isn't always. That's really going to be on the outside of the elbow, given that name because it can be associated with a one-hand backhand motion, like can be seen in other conditions. So when we think about how do we handle people with tennis elbow, I always say the first thing we want to do is the 3Ds, which is going to be data first, diagnosis second, decision three. And one of the important points we want to skip over is, are we actually sure about the diagnosis? So this is going to be the term differential diagnosis. So if somebody comes in with pain on the outside of their elbow, what else could it be? It could be things like a pinched nerve in the neck, it can be arthritis in the joint in that region, it could be some type of occult fracture, it could be another ligament injury like the annular ligament, you could be having a loose body, it could be a radial nerve injury. So and that's just assuming it's on the outside of the elbow. I have a lot of patients who come in to see me who tell me they have tennis elbow and it's actually on the inside of the elbow or the front of their elbow or the back of their elbow. So the most important question I ask is, hey, can you point where it hurts? So typically when I see people, we may be spending half an hour just even clarifying that we're even dealing with tennis elbow. Assuming for the moment that's true, one of the things I want to first talk about is what not to do. Two of the mainstays of treatment are non-steroidal anti-inflammatories, which are going to be things like ibuprofen and naproxen. Please see our other video that goes into details about why that's not a great choice, but it really prevents the connective tissue from forming properly. The other thing is for tennis elbow, that is the part of the body for which cortisone injections have been most shown to not be effective. In fact, it's not just that they're not effective, but it's actually been shown that when you do cortisone injections for tennis elbow, people do worse in the long term. And that's been shown over multiple studies. So it's the one place in the body that I'm an absolutist that you really should not be doing cortisone injections for tennis elbow at all. So what should you be doing? I think one of the mainstays of tennis elbow management is making sure that you're not overloading the tendon and that you're giving it a healthy, appropriate load. When you deal with injuries that are away from the body, what we call more distal injury, like the tennis elbow type injury, a lot of times the reason people have pain in that area is you're asking a small body part to do more, what a big body part is supposed to do. So for example, if you're doing a backhand in tennis, a lot of that power should be coming from your hips, your spine, and your shoulder, not so much your elbow. And so a lot of times it's an overuse injury because you're not having good proximal control. Other things that we've been shown is doing eccentric loading, which is, for example, if I'm holding a weight, it's lowering that weight down and doing lots of high repetition eccentric loading can help to remodel the tendon. Long, slow loading can be helpful as well. There's also something called counterforcing, for example, wearing a strap across the area of the tennis elbow, and that helps to distribute the forces more evenly. A common brand name is called CHOPAT, C-H-O-P-A-T. You can also use different types of taping techniques, and those just help to redistribute the forces. The other real mainstay of treatment for tennis elbow is improving blood flow. One of the ways you can do that is using nitroglycerin. Nitroglycerin is a patch that you put on the skin, and that will then, in the fat cells of the skin, release nitrous oxide. Nitrous oxide is a vasodilator, so it just helps to improve the blood flow to the area. So it can take an injury that may have been destined, let's say 6 months to heal, and cut that in half. It's a very slow acting process. You don't really notice the patch when it goes on, but it does seem to hasten the healing process. The other thing we can do is use regenerative medicine techniques like platelet-rich plasma. And that's going to be a technique where you take blood out of the body, spin it down in a centrifuge to concentrate the 10% that has the highest density of healing factors, and put that back into the area of injury. It's not the most comfortable thing in the world. It actually can hurt quite a bit for tennis elbow, so people often feel worse for a few weeks, but typically at 6 weeks, 3 months, and 6 months, people do notice a big difference in improvement. So this is some of the stuff we think about with the management of tennis elbow. I'm Gary Chimes from Lake Washington Sports and Spine.